Oh, thank you again, Raquel.
Always forget.
With, Clotilde as virtual, Heather, Laquita, I guess that's the three of us who are here. I'm expecting Liz to join us, but it will be virtual. She did ask for that. And Monique may very well have to as well, with a standing situation that she has in taking care of her parent, her mother in particular. Okay. We have a situation where there are 3 sets of minutes because we were without a secretary. And we were so grateful to have had a secretary for a while, but we did not have November, December, and January minutes until tonight. And actually, the November minutes were done initially by Clotilde and edited down by Evan, so they're in the packet. I emailed to committee members this, late this afternoon, those additional. And the November minutes, have been, voted on approved because, Clotilde done such a magnificent job with the almost word for word. So they were approved, but, the edited version is in the packet as we had promised. The December version, draft is, through, or up to where we had, the grantees from West Harlem Development Corporation. And, I did those, and then there's the January minutes, that I did as well, those are total. So, that had a chance to read them, but, what we have done generally is, and you can decide to do that tonight, approve them, and then if there is some modification, generally there hasn't been because we used the recording as well to double check ourselves. So if you, want to move to accept those minutes, we will have those out of the way for the board to see at the executive committee and be part of the general packet for February. And we have Monique who has joined us, and I know she had mentioned to me that she may very well be need to be in a virtual commitment with us, right now. So we have 4 of our members present, by virtual and in person. So is there, how do you want to handle the minutes? Do you want to vote, to approve as presented? And then if there are any corrections, we bring them forward at, future date. I'd like to entertain a motion to do that.
I would second that motion that we accept the minutes as is unless changes are forthcoming.
Can I get a second? That was actually a motion, because I can't,
Do we have a quorum?
we have a quorum.
We do, okay.
The quorum is Monique, Clotilde, who are virtual, you and I. That's 4.
Is Elizabeth here?
No, she's not yet.
Okay,
I second.
Okay, Clotilde has seconded. All those members, in favor, say aye.
aye.
I
Okay, so finally, we're caught up with our minutes, and thank you for that. What about the agenda, which I should have done first? Do you have the agenda in front of you?
I didn't see the agenda out over here. Did I miss it?
You want to put it on the board?
Can you do it, Clotilde?
I don't have my phone with me. I wish I could.
I can do it. If you give me
Thank
the,
you, Monique.
if you allow me to be co-host,
Oh, okay,
then I can
Great.
share.
okay.
I didn't print it because I
I know
just assumed.
I cannot leave my screen, so I want to stick on the screen. So if I have to go upstairs, get my phone.
I would try to.
Okay,
Okay.
let's see. All right,
Thank you, Monique.
okay, give me a moment to find it. I think this is it. Okay, can everybody see it?
Yes.
Yes.
Okay, good. I will enlarge it in case. Okay, is that better?
That's very good.
Yes,
Okay.
Thank you.
thank you,
Um,
Monique.
You're welcome.
Adopting the agenda, is there anything anyone would like to add to the agenda?
Actually, I sent something later on when I was looking at the rezos that you sent earlier.
Under res, that's just discussion under reso, right?
Mm-hmm.
Yeah, but in terms of new stuff, maybe it would be something new that I wanted us to consider. So do I, the thing I was concerned about that I wrote earlier, Laquita, was pertaining to mammograms and the delay in women getting appointments for mammograms.
That is our, public health forum. And then if there's something you wanna add, we can add that.
Yeah,
Public health forum from what I read.
right. It was as an area of concern that I wanted to bring up pertaining specifically to Columbia Presby, even though we have another health center on Heritage Health, right? I believe Dr. Milano, is she from Heritage Health?
Which
Yeah, so I just had a concern about that. So I was hoping we might take a moment to discuss it later on after we've gone through everything else.
Yeah, can it be on new business?
Yeah, can we add it to new business?
Yes, we can.
All right, thank you.
I look at it, Monique, as well.
Okay.
The waiting time, etc. Yes.
And we'll try to get through so we won't be late because we do have some important items. Everything is important to discuss.
Exactly.
Let's see, any announcements? Okay, and so we'll go forward, go forward with presentations.
I'm sorry, did we accept, was a motion made to accept the agenda?
Not yet.
Actually, the most, let's make it now as amended.
Okay,
Let's do amended.
so yes. I make a motion to accept the agenda with the slight amendment in terms of new items. On the new items.
Is there a second?
I second.
All those in favor, all members in favor?
I,
I
hopefully, there's other ayes.
did.
Okay. Okay, has been moved and we have amended the agenda to include more timely mammograms. I guess that would be the way we would do that. Is there someone here from Department of Health? Is Pauline Ferranti here? If not, we'll move on to an update on our CB9 and public health forum. We had our most recent meeting today. And prior to this meeting, we've had the meeting very regularly and we finally got a date confirmed, March 16, Saturday, March 16. And it's from 11 a.m. to 3, but we can extend until 4. We have a flyer in both English and Spanish done by our co-chair Edwin Torres. And as we move forward, it will say 11 to 3, and then 3 to 4 will designate something special that will happen at that time. Our honorary event chairs, well, let me just say that the idea is for the community board to introduce its community partners to more people within our district to make their services known, but also in particular to expose our community to more research, clinical research and trials that they need to have information on. Columbia University's Urban Medical Center has agreed to co-sponsor this event with us. I'm very pleased with that because they have a host of noted, highly respected, medical providers who have, taken leadership in this area of clinical research and trials. And at a forum in June of 2023, they had research professionals, different, ones, people of color, presenting and talking to us about, number one, cancer. There was one research study done on that, one on tobacco. And, there's a third one that they presented that's not coming to me right now. But it was so well done and, with, English translation. And, it was very well done, 15 minutes, and, the question and answer afterwards, one presenter for each topic. So that was the design that we thought of in this, three-person panel format. They are working on the professionals that we have requested they highlight, for us. In one of the areas, not only cancer, I'm not sure which area, the cancer presenter will have, up-to-date data on. But that there will be a subject, on cancer. The second one is maternal mortality. That is a really growing and huge issue in our community. So we want, to make sure that there is someone discussing that. A couple of weeks ago, only a couple of weeks ago, Governor Hochul announced that she is, making a priority of hers infant mortality and maternal mortality. It was very critical for us to hear that and, know that, some money will be put into why that is happening, trying to uncover, factors and, also to encourage doulas. Now, we had a presentation from a doula last year when this first came up. The issue is even bigger than with doulas. It has a lot to do with the administration at hospitals with providers who may not be listening to the mothers tell them what is what. And then also it could be that some of the mothers who think that they're okay just run into problems and don't know how to articulate it. So anyway, that, was a pressing concern for us. The third issue, youth and mental stress. So we have a whole segment that's going to be on another floor, dealing with youth-related health issues, particularly handling mental stress. There's a fourth, one topic dealing with the cure for sickle cell. That is a very, very big topic. It seems as if, when Dr. Clotilde announced it in, November, I wasn't sure where the research had come from, where that breakthrough had come from. But it seems as if, Columbia has, some role that they played in, and we'll want to talk about that. That is major, particularly since people of color, are heavily, at risk in the past annual for sickle cell. There's also what, Monique had wanted to bring up and, have us discuss, and we did mention it at our meeting earlier today, the effects of cannabis. She has a researcher who has data, and, there will be an opportunity for that data to be presented. So those are the, experts that will be speaking to us. The forum is pretty huge. And in addition to the youth workshop that will take place on the third floor and upper floor, on the main levels, there will be, table sponsors. And we have about 20 now that are committed to being part of our, sponsors through tables. And, we're looking for, I would like to have a company on pharmaceuticals, and we're gonna, work on, particularly Pfizer and Merck because of the research that they've done. Hopefully they can have a booth in this, at, inside the forum as well. Let's see what else. The capacity as I understand, it's actually one side. One side, has a capacity for, roughly 200, so does the other side. So it could be that if people are trying to start a place, it could be a number of 400. So I can't read.
Laquita, I'm so sorry, but it's hard to hear you sometimes. It sounds like you're speaking underwater. I don't know if you have to get closer to the mic or something.
Thanks for mentioning that. Can you hear me better now?
Yes.
I don't
Yes.
have the sound on with my computer because if I have it on, there'll be an echo. So thank you for bringing that up. And, I don't know what part you might have missed.
Capacity, you're talking about capacity at this point. One side capacity, there's two sides.
One
Yes.
side has, not over 200 and something, and then the same with the other side, but I'll get those numbers firm. Right now, we, generally at these kinds of events, people sort of walk through and get information. Hopefully, we won't be over capacity at any one given time, but we have the, panels set up for, a maximum of 70 people on the main level. And with chairs, facing in such a way that it can accommodate, close-knit, but not super close. There should be very comfortable auditorium style presentation with the use of videos and, slides as needed. And so I did mention the four topics: cancer, maternal mortality, youth and mental stress, sickle cell, and, cannabis. So, those are the topics now. They will all be presented by Columbia University Irving Medical Center professionals, except for the topic of cannabis. And I think that professional, she coming from Mount Sinai?
That's correct. She's a researcher from Mount Sinai. I'm trying to remember what division she's in, but she looks at the neurological effects of cannabis on those who might consume or partake in the use of it, and being mindful about a number of things, quality, which would speak to the health committee. You want to make sure if you're taking something that is quality and that's not harmful. She's been doing this type of research for a long time, and I can send some follow-up stuff pertaining to it, Laquita.
Yes.
Right. We're gonna need her information. We want to produce a brochure.
I see.
So we'll need the name of the professionals. We'll have the name, of course, of the committee members. We'd like to have photos and whatever. We'll have, some brief description of the workshops. We have a little time, but we need to start collecting the information now on that. At the table, there will be persons who, or agencies that have, that can provide demonstrations. And the demonstrations will be like with yoga, and how it can help alleviate stress. There are two organizations. I see Tamisha here. No, it was Antonika's organization, Housing Works, that, has a program with, chair yoga. In addition to that, 3.5 acres yoga can also provide a demonstration. It's an opportunity for us as Community Board 9 to have the West Harlem Development Corporation grantees showcase and even have some of their participants, use it as a day of health for them. And so that's a way of, making sure people know about it, make sure they attend. And that is to enlist our West Harlem Development Corporation grantees to get the information out to all the persons that they service. And it's a day, becomes a day of health for them, as well as the information we need to put out on radio, television where there's, some community access, whatever we can put up on, Link NYC, and mailing to, we also talked about mailing to some of the classes, students who are in medicine at Columbia University, at City College, wherever there are those looking especially to hear from the experts, do their presentations. And we are also asking not only our committee members, but some of our organizations that are mailed to, when I send out the agenda, to recruit or send out information to their constituents. In the application form that's part of the forum, there is a registration form. So I'm hoping that you guys use the QR code to at least look at it and register for the event. We need even our committee members to do that and tell other people. So far, are there any other questions or statements that people want to make?
I have a question, Laquita.
Yes, Heather.
Forgive me, but did you send us out a working list? I may have missed it in the emails of the organizations that you're currently working with.
I did not, it's in the event planning outline. Yeah, there's a document called event planning. So at
Was
that,
that in the email that you sent?
it's in the email that was sent announcing this meeting.
Oh, okay.
And also I did a second email, actually it was to the committee members.
Okay.
And it does
I
say
may have missed
event
it.
planning. And there are other organizations, so if you have other organizations that you like for us to consider, please, we're not, I know there's a limitation to what what can be housed or tabled, at the forum. But we may have people drop out, we may have some that become more of a priority than others. So I believe their capacity is anywhere 25 to 30, somewhere in there. So, we'll see. And what I need to do, I promised Kim that we'll be staying in touch with her based on the number we have. There was a packet sent out asking, table sponsors describe what they would set up at their tables. I heard from some people, but I haven't heard from everyone. We need to know if you need electricity because the outlets are very limited. But depending on how it's set up, perhaps there's some extension cord that could be shared. And most tables probably won't even need electric outlets, but it's the kind of thing we have to ask just in case. So as to accommodate those. Glad to have a laptop at the table. Where you can, and for some, you could charge to a certain extent so that you, once it's used, it gets low on battery, you may not have to use it after it served its purpose. So anyway, I've gotten some forms back, so I'm gonna hopefully tomorrow have time to, or just make time to look through the forms that have come in. But we really need, people, and we need, for example, I believe, Wendy, who is on, she's chair of, Tau Omega Charitable Trust Fund. They're a grantee of the West Harlem Development Corporation. And they have been stellar in working with our public health forum to put together the youth workshop. Next Monday, there is a meeting with just, well, actually it's February 19th, the youth workshop group will be meeting, but they also have met by telephone. And will need to fine tune, the flow, how they see their workshop flow. And I'd like for Wendy to say something about what you've had to speak on it. This is a whole new group. And hopefully you'll be able to speak on, the youth workshop. Can you talk to us now, unmute and
Sure. Good evening. So we are very happy to work with the committee to put together the youth programming related to mental health. It is our aim to provide 2 workshops that we have already developed on stress, anxiety, depression, and a second one on the effects of social media and youth and mental health. We have some videos that we created that we would like to have displayed on the 4 disorders that I mentioned, or the 3 disorders: depression, anxiety, stress, and our sleep deprivation. We have worked in the past with Triumph, which is a research study coming out of Columbia that provides mental health awareness screenings. So we have invited them and they have agreed to come and work with us to provide screenings for the young people. It can also be done for adults as well. There's another group that I think the Youth Education and Library Committee has suggested to do some interactive exercises. Iberia, I think is their name.
Iberia,
Iberia,
they do brain exercises for young people.
yes. And so that they're not just sitting there listening, that there is some interaction. We would also like to provide time for them to have some one-on-one time to talk with the mental health professionals that are there to ask questions. In addition to organizing the workshop and the youth forum, our organization will have a table. I have to submit the paperwork, but we are will hopefully have a table that will have resources for the young people. And we'll also promote our other programs because we provide scholarships. We're trying to do libraries and family daycare centers. And we're affiliated and work with the Tau Omega chapter of Alpha Kappa Alpha Sorority Incorporated.
And Wendy, that is fabulous. You know, we need your form for the table to make sure we don't omit you from the table, knowing that you're doing the workshop on the 3rd floor. But if you will, complete the form for both, because they both represent space, the table.
Yeah. I made a note from this afternoon that I need to get you the form, so you will get it shortly.
Okay. And also, BioBus might be a part of, we have to see, Dr. Marissi was at the meeting, we have to see if BioBus will also be upstairs with you guys, or if they will just be downstairs, because they're youth oriented. But it may be that they could just be downstairs, a catch point for all young people, and maybe have someone upstairs if there's, just to listen in, if there's an opportunity for those who want to go into the medical profession or biology or any STEM.
That's one of my follow-ups from our meeting, to just follow up with her to see how it would work together, if it would work together.
Okay, and we don't have our youth libraries co-chairs, but you guys made and I did too, reference to them. So the Ibrea suggestion was really great. Shanika had mentioned that she would follow up with them and get back to us. We need to know pretty soon because of, the formatting, the space and formatting of that day. And then, of course, you guys had already had some relationship with Triumph, and I remember Deirdre mentioning them. So that was good that they have not only a relationship with Community Board 9, but with your organization as well.
Yes.
Any other questions about the forum? Let's see, who, what, when, and where. The address for entering is 605 West 125th Street. It's a beautiful building, beautiful new building, as part of the Columbia University Manhattanville campus. At that entrance, we hope to have, registration, computers to register people, and have, information like name, email address, perhaps how they heard about the form, if they didn't register online. If they registered online, then we just check in if they're present and check in their name. But, if there are those among you that, help us with, say, that point, registration, people who are, guides, who could help that day, maybe 6 or 7 people walking around, making sure people are finding what the information that they need and other, that would be good. Whatever support you can lend us, we are looking to get that. We don't have a rain date, so hopefully there won't be any need for any either. With the location, we have pretty much everything inside, except this part is really big. And we need, everyone to know about it. What will be outside are a couple of vans. There's the, dental screening van, that will be available to us. And, I think it was Sandra today who referenced them, and I know Victor had asked us about that, so they're working on getting the dental screening van there. So we'll have a section where people can sign up to be screened for dental care as well. Then there's the mammogram van that Dr. Milano has put together. They have to have 20 people pre-registered for that van to come. And I know we all have someone that we can recommend. So there is a registration form that will go out probably, maybe before Monday, but on Monday, February 12th, every provider working with the screening will be in a meeting to discuss how the flow of screening, how the screenings will go. So keep in mind, persons that you know are interested in being screened, the minimum is 20. I don't know what the maximum is, but they haven't said. I think everybody who signs up will get screening. If it's not that day, they will make an appointment for another day. Time that's out. And keep in mind too, that there are men. We oftentimes think of women in terms of breast cancer. But there are men who need to be screened too. Dr. Milano's, I don't know how that's done, the mechanism for that. But she'll be able to, she's gonna look into that herself, and be able to give us some information on Monday. The other screening that she has worked through is colorectal cancer screening. There is a lot on radio, on television. There are a lot of young people.
Yes.
For some reason, there's an increase in young people who are having problems and actually dying from just not knowing what's what, didn't have it checked out, never were told that they needed to check themselves out for colon cancer. There will be screenings. We really have to have the word out on that. That's really, really big, and we have to find a way to, eliminate that risk and danger. And one way is early detection. So that will be available. That's really big on that day. At the forum, they will help. Dr. Milano has some screens and all, but the forum people will be assisting also to ensure that there's privacy for that. It will not require a van. So the 2 vans are dental screening van and the mammogram van. And what really singles out this forum is that we will be spending and have available people, for people, professionals, experts, talking about clinical research and trials. And as
Will you
Doc-
be testing for diabetes?
Oh, yes, Heritage, that's the healthcare facility that Dr. Milano heads up. There will be blood pressure
Okay,
and finger sticks.
okay.
So there's one other thing that they're gonna have there too. So there's a lot that there's Dr. Milano. Okay, I just finished talking about mammograms, colorectal cancer. You may have heard me, I hope. And then, someone just asked about finger,
And do we have someone for podiatry?
is
The
there,
Touro,
well,
Touro College.
Yeah,
does
there's a podiatrist
podiatry.
we have not, Dr. Milano, someone asked, one of our committee members asked about, podiatry. And I think this is all under the diabetes, detection and care as well. Although actually podiatry can also help with. be an
But the
indicator of
Touro
circulation.
College has a team that goes out and does the, you know, I know they've done it for my
Did you all hear
church.
that?
Yeah,
Did you,
Touro
Heather
College.
just said that and Monica, Touro College
on
has,
25th Street,
a group that goes out, with podiatry. We could ask,
screening and testing.
although I would love it if Dr. Milano would take that. If you can take that on, because everything deals with screening, I
Yeah.
think a medical person posturing in a certain way can be good. You're muted, Dr. Milano. You're muted.
I'm sorry. So I'm going to have to check that. And the reason is because as a federally funded community health center, we have to specify in advance, I mean, not advance this week, I mean, in advance, once a year when we update our documents, what we do. So it might not be possible because it's more than simply a screen. If people are going to ask about their bunions and what to do about the bunions. And so then that crosses the line into providing medical care as opposed to simply doing a finger stick as a screen or a blood pressure as a screen. And the fit test, what happens with the fit test, that will be from the Karen Schmidt people, the Columbia, the Manhattan Cancer Project. And the people who have insurance will not be eligible to go home with a fit with one of those little kits that they would do at home and then mail. And they have a really excellent way of following up. They call the patient, did you do it? Oh, you didn't do it. Do it tomorrow morning, put it in the mail. Then they call them 2 days later. Did you do it? Did you do it? And so, but people will be told that they should go to their primary care provider. We will have, you were talking about having 5 people running, walking around. We will bring a contingent and they will almost all be, the only person who will not be able to speak Spanish is me. And so everyone will be there to help out, and we'll have that. We'll bring a contingent of people to help with the patient flow.
Concerning the, let me go back to Truro. What we can do is maybe they can have a table
Yeah,
and just talk about what's available there, you know, the address, and then they can set up appointments for
Yeah,
podiatry.
So what they
I'll
probably
do that.
can do is there's it's a little we call it a microfilament. It's a thin, skinny piece of plastic, and we press it on, sort of their toes, 3 toes, different spots in the feet to see if there's any loss of sensation. And so they might be able to do that as a screening, and that would be wonderful for neuropathy. from
Okay.
diabetes. Yeah,
Yeah.
that would be
very-
fantastic if Arturo can do that.
Yeah,
Okay, and I'll have to ask you about that part again, so that when I call, and you're saying, Dr. Milano, it's best that I call because you, as a federally FDH, QHC would not necessarily, be in a position to do that.
That's right, because we have not specified it in advance. And our podiatrist doesn't work on Saturdays because that's her, because of her religion, she just does not, she doesn't work. So I wouldn't even be able to bring a podiatrist.
Okay, so I will reach out to you just for the language and talking to, Churro, but it's a great idea.
mhm,
Um,
it is a good
then,
idea.
yeah, now there was something else, can you talk about, the setup for the screening, the mammogram? We can have a video, while people are just waiting. Are you saying that they can actually talk to some of the professionals, providers that are on the spot? There are some worries or concerns. I don't know what the dividing line is in terms of what people can or cannot do in that setting. Yeah, I guess that's the primary question. And then, but information is the time while they're sitting or coming to that area that they can still get some kind of health information, is what I'm thinking.
That is correct. Yes. Yeah. The pediatrician will be there for sure. She's completely bilingual, and I will rope a couple of other people, providers in as well. And I'll be there, so obviously.
And so we really have to think about the flow, because you and Dr. Hotel are honorary co-chairs of the event, and I had initially thought you might moderate the experts panel. But we may have to set that up differently because you may be needed more in your area, screening area. So we'll see how, and you know, how that needs to work. That can be partly determined next Monday at that special meeting for those who are doing screenings. Was there another hand up? Was there another question related to what we've talked about so far? This is going to be an important, significant gathering where we hope we can have a lot of people from the community or representatives from the community. I was even wondering, even say from the youth standpoint, Dr. Maritzi says she had 40 persons involved in the bio, but I mean, all 40 might want to come round out their healthcare studies by being part of the youth workshop. I don't know. But I'm wondering, and to make sure that all of our high schools are represented in our district, maybe there can be some ambassadors from the high schools and they go back and report to their schools. If you think about that, then that way, and even, I know you're dealing with 17-year-olds to 25, but I'm not sure you're gonna come up with a number or maximum number after you see the space that you can accommodate. But maybe that's one way we can make sure that principals know, and maybe those that are in STEM programs in the high schools and colleges, science, technology, biology programs can be ambassadors from their respective academic locations.
You need, LaQuita, you need to reach out to all the high schools and all the notice to the district, what is it, 5 and 6?
District 5.
Yeah, they have to be notified. I mean, we have, A. Philip Randolph right up here. We need to send a communication to the principal and also to the high school for plant science.
Yeah, that's what, we know we have to make sure that the high schools are represented, and perhaps that's one way, making them ombudsman, ambassadors coming to the forum. can you, contemplate that when the workshop and, with Shanika and Deirdre and see what we can come up with?
Yes, yes,
I think, if I'm not mistaken, we have about 4 high schools in our district.
yeah,
So if each of them had 5, ombudsman or other, and they go back and forth to their school, that's pretty good. But there could be, again, if you can hold, just depending on how it's set up and what your maximum is.
correct.
And Laquita, have you reached out to the FDNY to be a part of the health forum? Because
The
they,
fire department,
yeah, because
Uh-huh.
they
No, I
provide
haven't yet.
useful information in terms of, carbon monoxide poisoning, and they provide free smoke detectors to people who show up to these health fairs.
that's a great, do you mind, cause I'm gonna need some help with, that, do you mind help? I know you're hands full too with landmarks, but
And this week I'm totally swamped because I
Okay,
have to go
just,
away.
I will make a note of that and I will reach out. This is where we have people who'll be so great, on the committee, those who don't have a particular role right now, but most of you have been really on the
in the
committee,
day.
active in some way.
But they're
Um,
very important. They always come to health fairs.
Right. I know Odette Wilkins and her group has signed up
Mhm.
with the technology aspect of
Yeah.
health. And issues that are facing us with, on the health issue, healthcare side. I've reached out to WEAC, I'm involved with their climate justice. So
Yes.
I'm hoping that they will have a table also, because they're really, important. We were gonna separate environment out, but this has been, right now, it would be great if they could just, it's hard.
Yeah, you can't
So if
separate.
they can have a table, and they're doing
Yeah,
so
FDNY
much.
always comes for the table and
And then-
handouts for kids, little coloring books and things like that. And,
Mhm.
and for apartment homeowners, they bring the smoke and the carbon monoxide detectors and batteries and
Great,
things like that.
another great idea.
Mhm.
I'll
Yeah.
definitely.
No, that's a great idea, Heather. Engaging with the local FDNY for sure.
Um, any, let's see, any other component? I know I said a lot, I'm not sure what might have been missed. I don't know if I hope I'm not still sounding like I'm underwater, with this. If there's anything
You are
that might,
not. You
No,
are
you
not.
sound good.
Perfect.
Yeah, I moved a little.
okay. So is there any other question? We'll have more information as time, between now and March. So just stay tuned because we'll have to, let's see, we'll have the general board where we can make the announcement this month. So you'll hear and be able to, another opportunity to ask questions or other, third Thursday of February. And then, of course, we have another committee meeting and another walkthrough before the actual occurrence of the event. Liz, you had mentioned an organization. I don't know how to reach them. What would be so wonderful is that if you just get the name and all the information, get it to me, I can send them a form. And if you could be the point person for them, concerning this event, it would be great. I don't recall the name right now, but I do have it on the event planning list. But there was an organization that you had recommended be contacted. I think they might have been emailed too, but I don't have a name or phone number to get back to them on.
Are you speaking with me, Laquita? I'm sorry?
Yes, you had recommended an organization.
Yes, I did. I sent them the form today. They're going to be speaking tomorrow for the senior committee, so I can follow up then.
Okay.
Okay, and I can get that back to you. I recognize they didn't get the form because they reached out to me today. So I handled that.
Okay. Very good. So I look forward to it. And Cheyenne, I'm so glad that you're on with us. I know that you have a lot of materials. I don't know if you have a booth that can, if you guys have a booth, since you guys do this so much, and if you need that, please send the form in terms of what your, if you have a booth, that would be exciting, there may very well be, 4 booths, but we need that information right away, so we'll know how to place you, and the people, at the forum can make sure the dimensions, the size of everything, if it's not a table. If it's a table placard, of course, that's okay, but, we just need to know what you have available. And we look forward to your being at the forum.
Yes, thank you so much. We're looking forward to it. Sorry, I just had one clarifying question. The booths have more space than the tables, I'm assuming. Is that the difference between a booth and a table?
Oh, it's already made up, it's already designed for education and training. Sometimes they're not very big, sometimes they are, but their space can accommodate it. I know that you all have so much, as part of Department of Health and Mental Health, you have so much material, and you have, interactive. I don't know if if your teen space, the new website could somehow, be demonstrated and used to show how it works. If you're involved with it, that would be great. I know Pauline brought it up as an addition. Perhaps it could be upstairs on the 3rd floor with the youth workshop. But Wendy, that's one other thing, the Department of Health has, the website, which you might recall, Pauline Ferrante mentioned in January. And it's called Teen Space. So, that could be another area, but everything doesn't have to be upstairs. So some youth may not participate in the workshops. So there needs to be something downstairs, on the main level for them as well. So that's an opportunity. We need to talk about that as soon as possible. Pauline's not here tonight, Cheyenne. I'm not sure if your area, if that's outside of your area, but let me know. And then we'll just make sure we can have.
Sounds good. I'll fill out the form.
Okay, please. And Dr. Milano, did you want to add something?
Yes, I was just worried about arriving early enough or in order to set up, or possibly to set up the night before. So, because we don't know how long it's going to take. And then we have to regroup so that we need to, when we arrive, okay, you go there, there's the bathroom. So so I'm just worried about having everything set up in advance of the arrival of the first patient, of the client.
And
Yes.
that was mentioned, and Kim mentioned there are some things that might be stored at the forum the day before, or I think maybe even 2 days before, but that could be brought up with her. But yes, I was thinking if we could have, depending on what's 8 o'clock, 9 o'clock setup time, the event starts at 11. So usually
Okay.
2 hours in advance should be enough.
That's good. That's good. Thank you.
Yeah, I don't think, the ones with booths, they know how to get those up really fast. And if we do have the pharmaceuticals, for example, I'm only hoping for 2. But they could easily set up. I think, what about the rest of you? You think 2 hours in advance if we mention it? But I know Kim did say some things could be stored in advance. You want to make sure that they're labeled. And what I also will do on the form that you complete, I included some things that the forum wanted us to be attentive to. But I need her to specify, in advance how many, you know, where things would be stored, contacting her for that. And being able to set up, say, at 9 o'clock in the morning. And we'll get that distributed out. Hopefully, those logistics this week and next week, because some things we won't know until after you as screeners, after that meeting on Monday.
Okay. Thank you.
Anything else? And, as I mentioned, there will be follow-up, just stay tuned. And, I will be asking for your very, very brief professional bio and, you know, for the brochure. And if anyone knows a creative person that would like to work with us, volunteer their time to put the brochure together, that would be great also. Okay. Let's see, the next thing on the, oh, and, CJ, we, in terms of professionals, on the mental health side, providers, we need to know who, Emma Bowen, is a great opportunity for Emma Bowen. So, if you would reach out, to, Ms. Jordan and, others there, we really need, professionals there on that day too, because, depending on how Wendy Tall Omega sets up a youth workshop, they may very well need 2 other, licensed providers who have experience working with youth. They designed the workshop, but they may need additional help depending on how many, people who can be accommodated.
Okay.
Okay, can you get back, to me, let's say tomorrow or Wednesday?
Yes.
CJ,
CJ. Okay.
I see him here, maybe he just has it on. Anyway, hopefully. I know he's with Emma Bowen. Okay, so what's the next item on the agenda?
1 second, let me see if I can pull it up.
Monique.
Hold on. I just had it. I don't think this is it. Hold on. No. Sorry, give me a moment. I'll find it. I have too many things open. That's the problem.
I think one of the things I might have mentioned was Anita Chang,
Yeah,
and,
that was definitely the next thing on there.
she indicated she could not be here this evening. She's almost done. She's done so much work, on these, and there've been changes here and there, as happens with, creative work, and she doesn't work on it like, say, one day, you know, one full day or anything. She, also has her full-time work. But, at any rate, she's working diligently, and I am hopeful that, this may get out, but it can run the rest of the year, basically, or the rest of the term through June. I'm just hoping we could get something on Link NYC that also speaks to our forum and using the flyers that we have or another kind of flyer, to attract attention. So I wanted to say that, so we won't have her, report tonight. However, the idea was to totally involve our community partners, recognize them, and show that they're participating with us, and there's some wonderful work that's being done. So I think this project will certainly help do it, and also working with the West Harlem, Development Corporation, that also helps us to do it as well. So, we have completed, moving on to resolution. We completed our resolution promoting residential parking for comprehensive environmental and health concerns. that was, signed by our board chair and sent out on February 2nd to, city council, and they do listen to what we recommend. One of the additions, was that, we certainly were encouraging, in fact, with residential parking, not to charge no fee for any, resident of our district. We didn't think that was fair because the residents are already paying taxes. And then, but at any rate, that resolution passed and I needed, everyone to know that. There was a resolution that we passed some time ago dealing with noise violations. And we did hear, from, Todos Nosotros, on January 28th. It was kind of, sad, actually, because, the noise that they complained about was in their, are the apartments above, the Broadway Billiards, bar and, another restaurant that is very popular. So they're not anti the business, but, the businesses are not properly insulated and the guidelines are not followed in terms of, the maximum noise levels. And as a result, there are a couple of people who, their discomfort and stress from having to deal with all that has led to, heart trouble, stress. And, we just wanted you to know that, we're trying to help. It's also been a part of, another committee that's dealing, not only ours, but, land use, I think it's housing, land use, and zoning as well. And, the Department of, oh goodness, Environmental Protection, Services Department has submitted, or issued, notices to them, to the businesses. It just hasn't been reconciled, and there has to be a way to do that, but, they're still working with them on it. And, we just want you to know, that we make a decision here, to help our neighbors, help our community. It's really important because we have to be concerned with the environment and health issues. And in some cases, that noise can really be, detrimental to health. We have mailed out to our members 2 additional resolutions that, have been drafted. And we want to discuss this evening, and I suppose after we do this, we will have completed our work. Those that can hang in there with us as we discuss, it would be great for you to have your input. But meanwhile, those who have to jump off because they have satisfied their, listening with, the discussion on the public health forum, we appreciate you and you'll be hearing from us. But moving forward, I emailed, even if you didn't get it earlier, the very last email that I sent out today to the members, you should see, resolutions.
I'll see if I can share it, Laquita, just give me a second. Cause I know I opened it, so which one did you want to open first, the infant mortality?
Maternal mortality.
Yeah.
That'll work.
Housing and then maternal, oh my gosh. This thing is.
Wow.
Your input, Monique.
Yeah, give me a second, guys. I have it open. I just have to find it. Resolution on, okay, maternal mortality. All right, let me see if I can open it.
It's called Resolution of Community Board 9 on addressing infant and
The
maternal.
last one was sent just way before the meeting. You have it.
Hold on.
Akil, I think, sent it to us.
Hold on, please. Thank you.
Oh, actually, okay, wait, that's probably not the right one, right? Oh, that's it. Here it is. Right?
It's resolution on Community Board 9, on addressing infant and maternal mortality with emphasis on local data and healthcare institutions engagement. And this followed, even though we had meetings where we talked about, at least 2 meetings, maternal mortality and doulas. This is also supporting what Governor Hochul has done and will encourage other, whether it's DOH or some of the other hospitals, to act. Okay, whereas the state of New York has recognized an urgent need to address rising rates of infant and maternal mortality with a specific focus on enhancing doula services for expectant mothers. Is there someone else who can read? So I don't have to do it. Well, anyway.
I can, you want me to read it?
Yeah, I'll let Monica read it, and then if someone else can prepare to read the resolution on housing. Okay, so read it, Monica.
You mean me, Monique?
Monica's here.
Oh, Monica. Okay, go ahead, Monica.
Draft Dr. E. Torres.
Don't, I already did the first one, let's go with the second.
Right here?
Second, whereas.
Oh, whereas Community Board 9 representing Morningside Heights and Hamilton Heights acknowledges that local data reflects particular challenges in these neighborhoods with late or no prenatal care rates at 10.9%, significantly higher than the citywide average of 6.8%. And preterm birth rates at 8.5%, slightly lower than the citywide average of 9.2%.
Hold on, so before we go too far, any comments so far on those, recognizing what's going on? Okay, continue on.
Whereas,
I do.
yes,
Was that Clotilde? Who was that?
Yes.
Go on, Clotilde.
Yeah, when they say specific focus on enhancing doula services, as for me, I would like to see more statistics and more number that will tell me that if we enhance a doula services, what are the statistics that tell me that we will reduce the infant and maternal mortality? So I need to do that homework in order to validate. Unfortunately, I didn't do it yet. I don't know if I can submit tomorrow afternoon my input.
Yeah, there'll be opportunity. So you don't have a problem with it. You see, we don't need a whole bunch of statistics, but at least a couple of vital statistics that can be added. Okay,
Thank you.
thanks, Clotilde. Okay, go on, Monica.
whereas teen pregnancy rates in Morningside Heights and Hamilton Heights are at 10.8 per 1,000 teen girls, indicating a critical need for targeted support and education for this demographic. Whereas Governor Kathy Hochul has enacted legislation S.1867A/A.5435A to establish a New York State Directory of doulas and has extended Medicaid coverage to include doula services starting January 1, 2024, thereby making doula support more accessible. Whereas the fiscal year 23 state budget has allocated $4.5 million annually to support regional perinatal centers, enhancing the level of care and coordination available to pregnant individuals and their infants. Whereas there is a recognized disparity in healthcare outcomes among different racial and socioeconomic groups within our community. which must be addressed with comprehensive and inclusive healthcare policy. Whereas Community Board 9 recognizes the need for local healthcare institutions to make wider efforts to help decrease infant and maternal mortality rates in Morningside Heights and Hamilton Heights. Now therefore be it resolved.
Hold on 1 second. Anything, among those are the whereases, anything, that could be more defining on the rest of those, 3 paragraphs before we move forward?
Yeah, Quidel has her hand up.
Okay, I don't,
Yes,
yeah,
I
okay.
do. CB9 is part of, there's 4 constituent. We have, what about Sugar Hill and the other one?
That's
We
not-
talk about Morning High, Hamilton High. What about Sugar Hill? What about,
I see.
Hamilton, that's Hamilton Heights.
No, Sugar Hills, where
is
the
it not
other.
4
Yeah, we don't have Sugar
areas?
Hill here, and I think it's in our,
Yeah.
it's on our
Sugar-
website and on our, letterhead.
Hamilton Heights.
Yeah, it's part of Hamilton Heights. We have, Hamilton Heights, Sugar Hill.
155th Street is where Sugar Hills.
Sugar Hill starts lower.
Right.
It overlaps, but Hamilton Heights covers it and Morningside Heights cover. The
Okay.
only other thing might be to add Manhattanville.
Okay.
How is
That's
that
part of
not,
Morningside Heights.
that's part of Morningside, okay. So those are the 2 big areas.
Yes, and here again, I would like to add some more data, specific data to put a little bit more weight on this resolution.
Okay, and
For which one, Clotilde, which we're
Uh,
at,
can you go down?
down or up?
Yeah, yes, go up. So you see,
recognizes the need for local healthcare institutions to make wider efforts to help decrease infant and maternal mortality rates in Morningside Heights and Hamilton Heights. There might be a third neighborhood, but those are the key neighborhoods. Morningside Heights, but if we can add, there's no problem, I'm sure, adding them.
okay,
But I think it's Morningside Heights and Hamilton Heights.
And I think Manhattanville may be separate.
In Manhattan, well, Heather thinks Manhattanville may be separate as I'm thinking it might, but I'm not sure.
That's part of Morningside Heights.
So yeah, because we don't want to be redundant, but I think we got it covered there, but I understand what you're saying, Coach.
No, if you wanna just put the,
But
what you
those
call
may
an
be
area,
areas
what is it, the
that have
containment area, what's it called?
The containment.
issues with the mortality
The-
rate, so maybe he was just pulling the data.
If we get to, if they might not be able to. They may not
Catchment
get-
area.
Yeah, the catchment area, they may not have the numbers that go right to, like, say, certain
Or
streets.
maybe it's
but we
only
might
those
do better
areas
by-
that have the disparate, this
Say it again, Heather.
discrepancy. Maybe it's just those areas based on how we looked at the data where there was,
Yeah, let's just look at the data again and see,
But I have a question. Is there any way for us to know or to find out how many doulas that we currently have in our community board or who service our
in our
community
community
board?
district.
Mhm.
Let's just ask the question.
I think we can find, because they need to be registered. And if you are
Oh.
registered through the city, the New York City and New York State, we can find you.
Can you, Clotilde, do you mind looking into that part further? How many doulas, to the extent, we can always say approximate,
Aren't they licensed?
Yeah,
They're
and they have to be
And they
listed
have to
as.
I
be
think they have
registered.
some certification, right?
There's.
No, the New York State should have that number with people whose addresses are 10027 or 10031.
Yeah,
Hi.
they,
This is Cheyenne. Can I jump in here?
Yes.
sure. Oh,
Thank
Cheyenne,
you.
they might have information on that. Go ahead, Cheyenne.
Yeah, I have some information.
Thank
So
you.
as you probably all know, New York City has a citywide initiative, a doula initiative specifically, and on their website, it lists out all of the doula companies or available, like where they're available through for each borough. It's not necessarily broken down by zip code, except they do list the zip codes that they serve. So I can see that there are 5 doula companies or organizations available in Manhattan that serve this zip code.
Mm. Those 2 zip codes, Cheyenne?
Your zip codes are 10027
And 131.
1031.
yes, both of those.
So is there
Information in the
anything
chat.
in the chat that we can pull up? Oh, you just did, okay. So, there's information, website that Cheyenne just put in, the chat that we can also follow up. Hopefully somewhat, the way I'm set up, I don't even think I can copy and paste
Yes.
that.
Thank you. Good.
Thank you, Cheyenne.
Thanks, Cheyenne. Okay, so more data as Clotilde has, suggested, so where we can find it, let's add it. Okay, now therefore, Monica. Now the first.
Be it resolved that Community Board 9 fully supports the state's initiatives and acknowledges the critical need for local action to address the specific challenges identified in Morningside Heights and Hamilton Heights. Be it further resolved that Community Board 9 will actively work to increase awareness of and access to prenatal and postnatal care, particularly doula services within its jurisdiction to address the higher rates of late or no prenatal care. Be it further resolved that Community Board 9 encourages the establishment of targeted programs to support teen mothers aiming to reduce the rate of teen pregnancy and provide comprehensive prenatal and postnatal care. Be it further resolved that Community Board 9 calls upon local health facilities, including hospitals and clinics, to actively collaborate with state and community organizations to ensure the implementation of these initiatives and the promotion of equitable access to healthcare services. Be it further resolved that Community Board 9 urges local healthcare institutions to intensify their efforts in contributing to the decrease in infant and maternal mortality rates through proactive engagement and the provision of comprehensive healthcare services. Be it further resolved that Community Board 9 commits to monitoring the progress of these initiatives within Morningside Heights and Hamilton Heights, advocating for continuous improvement and expansion of services to meet the specific needs of the community. He needs to specifically put in Mount Sinai and Columbia.
And is there another hospital or other?
There's no hospital. Those are the.
Harlem Hospital we use a lot, even if.
That's down it. Yeah, you can do that.
So we're in the last, be it further resolved, which one?
Third up.
There are 6, be it further, wait, 1, 2, 3, 4, 5,
No,
6.
just from over here, from back here.
Yeah, it won't always be that way though. Anyway, so the, third from the bottom paragraph,
Yeah.
add hospitals,
Name them.
name hospitals, in our area. The only, okay, Mount Sinai, Columbia,
Well,
How-
for now,
and then I think we're gonna put Harlem there. because of the network. Okay,
I'm sorry, did you
Any-
say Harlem Hospital?
yeah,
Yeah,
yeah.
people do go there. I mean, it's relatively accessible, so.
Yeah, I mentioned it. I don't have any objection. Is there any addition or because that's where it seems
Did
a
you say
lot.
Mount Sinai? I'm sorry, Laquita.
Mount Sinai, yes.
Columbia, Harlem,
Uh-huh. Mount Sinai, the three hospitals seem to be Mount Sinai, Columbia, and Harlem for our
and
district. And even though Harlem's not immediately in our district, it's still people refer to, they go to it because it's
Well,
location.
people on Medicaid, that's where they go. Black people on Medicaid, they go to Harlem Hospital, they don't go to Mount Sinai.
Mhm. So we have, any other be it therefore, I just really think the hospitals are key also because it seems to me that a lot of this is happening in hospitals or the mothers leave the hospital, go home because, and the doctor poo-poos what they've said.
I
When
want
they,
to add something. I'm sorry, I had my hand raised.
I'm
Somewhere
I'm glad, speak up. Go right ahead.
when we talk about the service for the doula, they said pre and post. They forgot the pair during the delivery. That has to be added as well. So I put it on the chat. Pre,
Okay,
care, post, care.
oh, I see it. That's the third, is that the third, be it further resolved? Yeah. Okay, so say, let's see,
Oh, well, you say prenatal and, postnatal.
prenatal. So there should be something in between postnatal.
Yeah,
What
which
was,
is we say pair, P-E-R. That means in the middle. Mhm.
Oh, okay, okay.
Okay.
Pre, pair, post.
okay, so prenatal, perinatal, and postnatal.
Yeah, prenatal, perinatal, postnatal. Thank
So,
you.
so it would be this paragraph here that everybody sees me hovering over, that we would prepare right here,
Uh, yes,
Flotil, right, this paragraph?
yep, that's
So,
it. And
okay, and then
actually,
what about the one above it too? The paragraph above it, this one here, within, be it further resolved and Community Board of 9 will actively work to increase awareness of and access to prenatal, and what about, does that pair go here as well?
yes.
Yeah,
Okay,
yes,
all
thank
right.
you.
So you would say anywhere where we have specified prenatal and postnatal to add pair in between, in the middle.
Yes, please, yes.
Thank you, thank you, thank you for that.
And we're talking about the healthcare systems. Do we have to mention Heritage Health?
No, I want to
Yes,
mention,
we, yes, Dr. Marino, because prenatal care, don't you do prenatal care as well?
Is
We
Dr.
do
Malone-
not. We do not.
Okay.
We send out, it's very difficult to find an
Yes.
OBGYN or a
Okay.
you know, a women's health nurse practitioner, very, very difficult.
Oh my gosh.
Okay,
Yeah, so many federally funded community health centers cannot compete with the salaries that the hospitals are offering, and so we are unable to find somebody, not even somebody part-time, or somebody retired who wants to come in a couple days a week.
I see.
Impossible.
Oh, that's unfortunate.
because of the malpractice insurance, there are no more OBGYNs in private practice anywhere in the country.
Wow,
There's no more.
you're right. Yeah, I get it. Yeah, the insurance is just like, oh, forget it. It's just makes it cost prohibitive to practice solo.
Mhm.
Got it.
Wow. Okay, so we're just going to mention by name those three hospitals.
Yes.
Anything else that we should consider? Now, we can read, we would add this in. Anything else that you feel very strongly about? That should be part of this resolution?
For me, I think this resort is very well versed. It really bring everything we need. We just have to put some few detail, and within a couple, by Friday, we can submit it. It's up to you. What do you think, Monique?
I think
We
it can, it seems like the things that you want to add, because I don't, well, I don't imagine it would be too long, but I think
No.
adding a few more stats just to strengthen the
Mm-hmm.
reso to state the importance
Yeah.
of this particular topic that we've been addressing for for a while now.
Yeah, and thanks to Cheyenne, she provided the website where we also can get some of the statistics. So, I mean, by tomorrow afternoon, so I'm already ahead of time. So you go to sleep, and I hope by then I'm gonna send you something.
Tell, do you
Yes.
mind, will you have time to take a look at the statistics that you wanted to add?
Mm-hmm. Tomorrow
Yes.
afternoon, when by afternoon, I will provide you some few statistics.
Copy and paste the, Cheyenne's, website info, okay?
Yes.
Now with the, recommendations that have been made, can we, entertain a motion to move forward with the resolution, with the addition of, data, more data on doula services, getting information on how many doulas, naming the 3 hospitals that we've already named, but into those hospitals, and with the addition of prenatal, perinatal, and postnatal. Can I get a motion to, accept the resolution as will be, amended, so we can at least present it to the executive committee? So,
I make,
is there,
was Elquita making the motion or asking for it?
Monica so moved?
Second,
Okay, all those in favor?
Aye.
I,
Aye.
Okay, and, okay, so we, anybody opposed? Because I think everyone is for it. I think, any opposed? Thank you, so we can move forward with that, we'll clean it up. And the executive committee meets next week. Wait a minute, is it this
no,
week?
I think it's this Thursday, in fact.
Yeah, that's February
This
1, it's on
Yeah.
Thursday, okay, yeah, the second Thursday. So we'll clean it up and have it ready for, this Thursday. I think it's really great because, as I mentioned, the governor has already said something, and usually we have been right on the money ahead of it. He, has done something that we really think is super, super important, so we're backing her and our community 100% with this. Okay, and then also it gives us something before March, our March forum, that we can say, we have done this and that, and we're for this, that, and the other. Okay, the second, resolution is one resolution of Community Board 9, oops, wait a minute. Resolution on housing insecurity and court system burdens for tenants in Community Board 9, New York City. We have shared this with, housing, land use and zoning, so they will take a look at it as well. But at least in this instance, let's read it, and then, there are a lot of, you'll be amazed, the stress that, dealing with housing and the court system can put on people. And after COVID, with landlords kind of doing pretty much what they wanted to do and wanting to kick a lot of people out, the court system was, stretched and stressed out. And there were a lot of people, put into very bad situations. It may have eased up some, I don't know, it has not, Monica, okay? But I think it's still strongly out there. We need to bring some recognition, put, try to, put some thinking on the parts of our city council people into what is going on. And letting people know how the community feels. Let's see, is there someone who's available to read this one at a nice pace and we can keep moving? Want to read this one, Monica? Okay, Monica is the reader. This is housing insecurity, we could put stress in parentheses, and court system burdens for tenants in Community Board 9, New York City. Okay.
Whereas housing insecurity remains a pervasive and escalating concern among residents within Community Board 9, New York City, leading to substantial mental stress and undermining the stability of the community. Whereas numerous tenants face the daunting challenge of navigating complex legal systems, often without adequate resources or knowledge, exacerbating their mental stress and sense of vulnerability. Whereas the requirement for multiple repetitive court appearances places an undue burden on tenants, compounding their mental stress and often resulting in missed work, financial strain, and disruption of family life. Whereas the mental stress induced by housing insecurity and protracted legal processes can lead to long-term psychological effects, including anxiety, depression, and a sense of hopelessness among affected tenants. Whereas children and families, particularly those in vulnerable socioeconomic positions, are disproportionately impacted by the mental stress and instability caused by housing insecurity and related legal challenges. Whereas the extended
Hold on
duration.
1 second. Up to that point, is there anything, I see Clotilde is writing something. What I want you to do also, Clotilde, is just maybe take a look, and if there's some wording, like I know that you said mental crisis. If there's a word change, don't hesitate to mention, as you look at it and review afterwards as
Okay.
well.
Yes, so it's-
No,
she
we
can
don't
go
have-
on.
Okay, anything, that anybody wants to make note of now before we go further? I'm not whereas children, whereas children and families, okay.
Whereas children and families, particularly those in vulnerable socioeconomic positions, are disproportionately impacted by the mental stress and instability caused by housing insecurity and related legal challenges. Whereas the extended duration of court proceedings, often orchestrated by landlords, serve to further intimidate and mentally stress tenants, dissuading them from pursuing rightful claims and justice. Whereas the lack of sufficient legal and emotional support services for tenants exacerbates their mental stress, leading them to face complex legal battles and housing insecurity without adequate assistance. Whereas the current legal framework and housing policies inadequately address the escalating mental stress and challenges faced by tenants, necessitating immediate and compassionate action, be it resolved that Community Board 9 urgently calls for measures outlined previously with a heightened focus on mitigating the mental stress experienced by tenants and providing robust support systems to navigate housing insecurity and legal challenges. This resolution reaffirms the commitment of Community Board 9 to the mental well-being and stability of its residents, recognizing the critical need to address housing insecurity and the associated mental stress with urgency and empathy. Well, first of all, we are a right to counsel state, city, which means that you have a right to counsel and housing board. But the problem is New York City is not. New York City is not funding.
I'm sorry, Monica, I can't hear you.
Yeah, we have this train that just passed. Okay, go ahead.
New York City is a right to counsel jurisdiction. People in housing court have a right to counsel. However, New York City is not funding, the attorneys, and so, legal aid takes so many cases in so many zip codes. And everyone should have an attorney, but we can't do that until the New York City Council properly funds right to counsel in New York City. Because right now, they are not properly funding the amount of lawyers that are needed in order to process everyone's case.
And we still should have the resolution.
We should.
Right.
I mean,
Yeah.
That means it's more recent, yeah.
Do you think that's something we need to make note of, or just make it as part
no,
of
you
the
need
letter?
to change, because here's the reality, nobody's gonna fund social workers for people that come and see this letter. But no one's gonna fund social workers to sit in housing court with people. I mean, if you really wanted to do something, what we could recommend is that HRA have someone stationed in every housing court in the city.
Excuse me, where's the letter?
No, everything's up here. What you can recommend is that HRA have people stationed directly in every courthouse so that when people are eligible for programs, they can take all the information that's been filed in court, enter it in the HRA database without people having to do that themselves.
Hmm.
So here's what happens. You have a right to counsel. A lot of people that go downtown are eligible for various programs run by HRA, Human Resource Agency. I think it's called. Administration. The problem is the person has to get the documents, which have often been filed already in court, go online, complete the paperwork, and wait for HRA to pay the landlord. There should be an HRA station at the courthouse, working with the court clerks and the judges, so that they can process the payment right there with no delay. That would stop 99% of the problems that are in housing court now.
So is there a way you can word that for for a special segment in there?
Yeah,
Whether
this
it's being resolved or
This
either.
one right here, be resolved.
Yeah, and this is good because it's a user persona. And if we can have another example of that sort, that bring you more weight in that resolution as well.
Yeah,
Mhm.
well, where is this data coming from? I mean, I don't,
What data are you talking about?
In this case, it's just a lot of people,
No,
I mean,
that's
I even
data.
have-
it's making a lot of assumptions. It's
There
not
there
data
is a
driven.
lot of assumptions that housing court is overwhelmed.
Well, the
Okay.
health,
That's-
housing court
We
is
can
overwhelmed.
probably cite, I think, Heather, we have a lot of, it, especially post-COVID, there are news articles galore.
Yeah,
And then many of us have personal experiences.
right.
Yeah, it's also very stressful for landlords, small landlords, to have to deal with these issues.
Right, and that's why we need a HRA representative sitting
No,
in
I
the court.
agree with you on that. I
Sitting
agree.
in the court to,
That would be helpful.
to just process. The landlords have to file all these things, all the documents are there. You know, they can work with the clerks so that people will, everybody's, you know, there's no question about whether or not the person filed it, it could just be filed.
And it was just have a process, a better process, and a process that's gonna be add some more effectiveness.
Yeah, I mean,
Is it?
it's more, sorry, I couldn't use the hand function because I'm sharing. It just seems more cost effective to have those representatives in the court. From what Monica is saying, it just seems like it just not even just time efficient, but cost effective than to pay and to keep somebody in their home.
Yeah, that's a good solution, but
That's-
that's not the total problem.
Did you all hear Heather?
No,
You may have to turn around, Heather. and say-
No, I think that's I think that's a very good solution, but that's not the only problem.
There's a ton of problems, Heather.
Yeah, we just gotta work on what we can work on.
People write books about the problems in New York City Housing Court. We're not trying to do that. We're trying to come up with a viable solution to try to keep people in their homes.
Well, yeah, your home, not having a home or having problem getting home.
Can I interject myself here?
There's Clotel, yeah, you have your hand up.
We have our ask, our wants, our needs, but the city will look at the cost. Can we afford having an HRA physical member being in all those places? One.
That's 4
Can we
courthouses in New York
use, like we
City.
do telehealth, is there another way where we can have call line or a tele social housing insecurity, the way you frame it, whatever, but somebody could be there 24 hours being present, listening to the resident, and in case of really a certain crisis, we can send them over there because it's gonna be costly to have somebody at each location.
Hotel,
Yes.
there's 5 courthouses, 1 in each borough that handles housing. Okay, we can have people centered there as
Okay.
opposed to having people go back home, file the paperwork. They tell them it didn't go through. If HRA has a center in every single courthouse,
Yes.
then there's no question about whether or not it went through. There's no question about the paperwork. Everyone's right there together. The clerks can provide HRA people with all the paperwork for that particular plaintiff. There's
And
no
this is wonderful. So it's left to us to reach, to outreach, and to provide, to disseminate the information that such services is available.
We need to come up with some.
well, I'm sorry, can we add some of the language that Monica, I mean, I know we're focusing on mental health. Can we add that language in here somehow to show that, we are concretely writing down solutions that seem pretty like no-brain solutions to me and put it in the reso to help to strengthen it?
Yeah, we're gonna add the user persona.
Is that what you meant, Carlo, Till?
Mm-hmm. We
Okay.
did the same for the parking residential.
And I guess a lot of times we put footnotes showing the data. I'm wondering if also, an example of resolving it, I'm not sure if resolutions are supposed to be done that way, but I'm wondering if we could do, I think it may be what Clotilde was talking about, like an example solution, like show it as a.
This is exactly, yes, that's what we did for the parking.
Right.
Yeah.
Victor, our chair has his hand up.
Oh, hey, Victor.
Hey.
Victor.
Yes, can you hear me?
Yes,
Yes.
Victor.
I've been jumping between meetings, but trying to keep up with both. Ironically, I had a discussion today with Palante Harlem on housing and homes insecurity. And they want to really step up their role in what's going on in the community. They have a couple of webinars this month about those particular issues as far as harassing landlords, and other issues. So I was gonna meet with the director at Palante Hall to, to dive into this a little bit more. So this was very timely that we could do this. Also, our city council member, Sean Abreu, is a former attorney in housing court, where I actually ran into him a few times. So I'd like to engage him in this as well. And Columbia, as I've said before, I met with Columbia's president this past Tuesday. And one of the issues I glanced over was relocation that's going on when they take over certain areas and what should be given back as a part of that. And that might be legal from their law school can assist as well. So just throwing out some ideas as I'm looking at what you're saying and hearing Monica talking about is 5 courts, and that's not too much to ask for the city to keep people in place in their homes, that we could have 5 people there that are advocating for these people that have issues.
But you know what, hold on a sec, but you know what, Victor? The problem with HRA is that all, that unit that handles that, it's about 30 people. They never come to court, and you know what, all they tell you, I know we were doing our clients' paperwork, and you know what they say, they never received it. So having them in the courthouse, you don't get a lot, you don't have a high volume in Staten Island. Your biggest volume is in the Bronx and in Manhattan. And I think the Brooklyn is third.
Okay.
But that's where you have, and you got a little bit in Queens. But you know, the volume, Bronx County does more volume than any other housing court in the country.
Okay, I'm quite familiar with Bronx Housing Court, having spent 10, 15 years there myself, so I understand what you're saying.
Yeah.
I worked in Staten Island courts as well, and you're right about that. So maybe our concentration needs to be on Bronx and Manhattan courts to push this forward. Just an idea, just throwing it out there.
That's
that we can
excellent.
do.
Again, it's timely, like Victor said, and we have to be in the forefront. We have to basically gotta help our community. Look at, we just try, we just gotta try.
There are people in HRA that have proposed this.
They
Can you
have
hear me?
proposed it, you said, Monica?
There are people in HRA that have proposed this
Oh,
in
okay.
order to alleviate the calls, the frustrations, the headache. They have gotten pushback from Adam.
All right,
Oh,
so maybe we can help them. We can, our city council member, the community board,
Yeah.
help push this along.
yeah,
Absolutely.
Okay,
There's
great.
space in these housing courts too, where, I mean, they could get a space, there are spaces where they could open up the office, work with the clerks, work with the judges, to make things flow easily. Because once it gets filed at the courthouse with them, you don't have to worry about them saying, I never received it. I had a client that had to send her paperwork in 8 times.
wow.
Ridiculous. Stress.
That is ridiculous. And I like the idea, particularly as Victor noted about Columbia, which they provide they have a legal clinic, that I know we're offering services for people trying to fill out applications in regards to the cannabis dispensary. So I'm sure that would be a stretch to find in the law school people who can maybe help in terms of housing court as well.
Yeah.
So I think that's also a good idea if we can bring people in to help out.
Right.
Absolutely, absolutely.
Victor, we sent this proposal over to Sydney and Liz. When does housing meet, tomorrow or Wednesday?
I believe it's Wednesday. I don't have my calendar in front of me.
So what we probably should do is try to clean up hours, vote on it, at least to go forward to get input from housing and land use, is that what you would suggest? I wanna try to alleviate some of, let's say a committee not feeling that they had input. We've worked with housing and land use before, so they haven't said that, but would that be the process, like we vote to move forward here with additions and then present it to housing on Wednesday? Or re-present to housing on Wednesday.
That sounds good.
Okay, and then if it's voted on in housing, maybe it could be presented at executive on Thursday.
Okay,
I think they meet next Tuesday.
Oh, they meet next week?
next Tuesday?
They meet on Tuesday.
Oh, the second,
Thank
they
you.
meet second, okay. So maybe what we can do is just present this to executive and then say that we have sent it to housing and await their input, and I guess be prepared for a March vote. It's just that it's so necessary, the sooner the better. And isn't city council doing a lot of voting in March, or is it April? Oh, March would still work out, yeah, they might do a lot of voting, funding and all of that for consideration, April.
Yeah, I think April, is it first, the deadline for budget, city budget? I mean,
That's what I know we got something on that, but I think if we vote on it in March, that should still be good for what we're asking.
okay.
Yeah.
All right,
And
you want me to stop sharing this, Laquita? Are we finished? with it? Are we finished with this, Razul? I
I
can,
was just gonna ask Victor, would that say if we vote to go forward in our committee, then on an executive, that gives Victor some more to talk to Sean Abreu about to get his,
Yes,
yeah, okay.
yes.
So why don't we do our vote just to at least move this to executive for consideration and any other committee that wants input.
okay.
Can we get a motion on that? With let me add, with what Monica has written, as what Clotilde call it, what'd you call it? An example, there's a terminology used, but anyway, you think this is all that's needed to be added?
User persona, the case, the user, and yes, the case user, the user persona that we're gonna add thanks to Monica, yes. Mhm.
What Monica has written is, be it resolved, she has added, be resolved that Community Board 9 supports the full funding of right to counsel. Yeah, that's very specific, in housing court, and the placement of human resources administration representatives in every courthouse to facilitate housing program payments on behalf of tenants.
Yes,
that's
and then if I receive the recording of this meeting, I will be able to write also a story about it and send it to you. In addition to Monica.
Okay. So we'll see, we may not need that much, we don't wanna make it too.
Oh, 2 or 3, not more. I know, I understand.
But if there's another example, just do it and send it, and we'll try to just include
Yes.
it.
Yeah.
That could be more time consuming, and you're out of the country, yeah, let's just
I'll
keep
be
it
back
simple.
this weekend. I'm back.
Okay. Thanks, Clotilde. And don't forget you have the other data that we need.
You
On
get
the other.
evening, tomorrow evening.
Okay, and so, can we have a motion to move forward with the resolution?
So moved.
Monica moved, so we need a second, Monique, are you a second?
I will second the motion.
Okay, all those in favor?
Aye.
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 Any opposed? Abstain?
I abstain.
Heather abstains. So, let's see, other members, my goodness, hold on a second, let me go. Can you remove the, agenda for me, Monique, so I can see, okay, see who's here. All right, Heather abstains, Clotilde, how do you vote?
Sorry to rush you.
Clotilde?
Yes, approve with after small change.
Uh-huh. Liz?
I support.
Okay, Monique? Oh, yeah, you seconded, so.
I second it, so I support it.
Uh-huh. Laquita, I support it. So right now there's 4 yes, 1 abstain. That should be our members. Let me see. Who's on? Let's see. 1, 2, 3, 4, 5. 5 members. Yeah, that's it. So 4 in favor, 1 abstain. Okay, so that should be noted in our minutes. 4 yes, 1 abstain. Um, okay, so there we have it. And if there's Heather, if there's something you feel that could be added to make it, to eliminate your abstention, just mention it. There's, just mention it.
Yeah,
Okay.
I just wanna look to see what the.
Yeah, just,
Economic, what the data is. and
Yeah, just,
psychological
okay.
Data is that's out there.
Right, so there'll be obviously, other times to vote on it.
Laquita, can I make a quick comment, Laquita?
Absolutely.
I put in the chat 2 of the webinars that are coming up. February 15th is renters' rights, and February 20th is your rights after a fire. And I put the RSVP at www.palante.org/webinars. So you go there to reserve your space to sit on in the webinar.
Thank you,
You
Victor.
can pass that along to any other, people of the committee or people who regularly attend your meeting. It would be good. They have some experts coming in to speak,
Okay.
right?
I'm wondering, is there any advantage, for example, of mentioning, say an organization like Palante, as we did make mention of hospitals and all of the other, not in this case? Okay, but they have a very good reputation, but if we don't need to, let's not.
Law, we're not talking about, taking it.
So, all right. Now, moving forward, there was an amendment, that was it for resolution, but under new business and to conclude, Monique had a consideration dealing with mammograms. And Monique, let's see, for some reason, I wasn't hearing you just then, Monique.
I wasn't
Are you
saying
muted?
anything. No, I'm talking now. Can you hear me?
Now I can, yeah, but the first part, you were saying something before and we couldn't hear, but go
No,
ahead.
actually, I was going to say I couldn't hear you, but what I was going to share very quickly was my concern. Recently I was trying to make to schedule a mammogram for myself. And when I spoke to the person because I go to Columbia Presbyterian to get my health services. I don't normally go uptown. I actually go midtown because of where I used to work. But the young lady I spoke to had mentioned that the wait to get a mammogram done was like some crazy number, like April or May. And I said, why is it taking so long? And I think I was doing it ahead of time, and still the wait was long. And then they mentioned that something had happened at the Uptown campus, and that people were I guess women were being diverted from services uptown to other locations to get care. And therefore that was creating long waits at the other locations. I'm sorry, what?
I think they closed the radiologist, the mammogram radiologist. I don't think there's any up there anymore.
Okay, yeah, something was happening up here. Thank you, Monica. And that was close.
Columbia?
Yeah.
Yeah, there was calling.
No,
Go ahead. I'm sorry, Laquita. Go ahead.
let's see, Dr. Milano's not on, but I know that at our meeting next week with the screeners, there will be one person there who may be able to answer that, Karen Schmidt. She's the one that put us in contact with the American Italian mammogram outfit, that van.
Yeah.
So something maybe, they may be it may be so big that they're letting it be done by another group, for a
Okay.
while until they get, I'm just guessing.
No,
But
I
we
think
can-
I think you're
answer.
right, but it just alarmed me that the wait was so long. And for myself, I pushed back. I asked what was going on, and then I was able to get an appointment a little sooner. But somebody who might not be as assertive might just accept it and end up waiting. And God forbid if something is going on with that person and they're waiting, time is everything. And so I just wanted to bring it to our committee to find out what was going on and to make sure that women in our community weren't being put in a very precarious position. We're already dealing with a lot, and to hear that was just very upsetting. So that's why I brought it forth. And I even told a young lady, I sit on the community board and that's unacceptable. And I'm going to bring it to the community board and see what can be done to address it, because that's just not acceptable. So I'm bringing it to
And
the board.
I even want to add something.
Yeah.
Yes, Cotil.
Breast cancer among our people, it's not even a stress, it's more than a crisis. So we have that particular, like we call the triple negative type of breast cancer, which is so devastating in the family, that's something that we will ask Columbia University during our public health forum to discuss about the latest advancement, because we cannot afford that people, young women, young family, young female suffer in silence when they are 30, 40 years old with a diagnosis of breast cancer, suffering, dying alone. So thank you for bringing that, Monique. We are supportive. Thank you so much.
It was
such
my pleasure.
resources
And,
that,
and I will,
around us, we have so
yeah.
much resources.
That's right.
So much,
So,
and
yeah.
that we can provide that. Thank you.
Yeah.
Thank
Is there anybody at the health fair that's gonna be talking about AIDS? Black women are 52% of all the new AIDS cases.
I think we're always in crisis, it's just, seriously, and it's just so much. We're not gonna cover everything, but I'm wondering if Deborah Levine's group can do that, because they brought to our attention, and Tamisha was on the phone earlier.
Yeah.
She works with Harlem Health Initiative. And she mentioned that they would like at the table also to talk about syphilis, which is on the rise. And it is on the rise, not just
60%.
teenagers,
We are 60% of all the new syphilis cases.
Black people,
Yeah.
or
Wow.
people generally.
No, black people.
So I mean, there's so much. What I will do is see if, and I think it doesn't have to be like, say, one of the, key research trials, but at their table, we can have them situated where there are people, as one of the people mentioned earlier, there could almost be presenters at tables, because a lot of times you'll see small groups that will gather around, certain tables when you go to conventions and all, and they're listening, and they have, video and all. I think Deborah's group is pretty keen on, pretty good in terms of that. I'm gonna ask if there's something they can do related to, I guess we would call it sexually transmitted diseases. AIDS, syphilis, those two I know are on the rise. I didn't know AIDS on the rise as much, but I knew that syphilis has been talked about in the newspapers, I think, New York Times, something. Yeah, huge article on that, but it was also big back in November. And I made mention of it at our meeting, but I didn't have any data, I just read it. But it does sound kind of funny, just on the surface, not how funny, but we are, as like Black women in particular, or Black people, but Black women, we're just in health crisis.
Yeah.
And so, we have to have a way to talk about that. So maybe there could be a section of the forum, because I think there'll be a lot of questions that people may not want in an audience format, but if, I think CUNY knows how to, I say CUNY, are they CUNY or down, State University?
Yeah.
Their city, their city, CUNY.
I see, okay, so I'll see if that's one that Deborah can do.
Yeah, they're for, and then they can even help us with collecting data too, if we get to them early enough. That might also be, I think it would be very important to collect information from, you know, these events to help us, inform us of what we can do next. And
Will you be having CPR demonstration? Because the FDNY also does that.
Oh, you know, let me just.
yeah, that is a
the
good
FDNY,
So just when you contact them, make sure you ask about that.
And what
And
was
they've been providing
Carbon
trainings in the
monoxide.
community too in the last month or two.
But the thing about it, they only come out if you have so many people signed up before.
Okay.
Well, that's what we're trying to do,
But they may
pre-registration.
even
We
just
need,
provide the information at their table if we can get them to come and do it.
if you get people, everybody has that flyer, and I have to circulate the one in Spanish. Please send it out. If we're requesting this, I gotta have some documentation that we wanted, that we have the people there. So we need you, actually, you have the flyer, so everyone has the registration form. It's on the QR code.
Laquita, can I translate that in French as well?
Huh?
Oh,
Can I translate that in French? Can I translate that?
Absolutely, Clotilde. You have it, right? You have it with you? The one, right?
Yes, we have a influx of undocumented.
Yeah. Edwin can, put it in place, on the diagram. How fast can you get it to us? Couple of days?
I say tomorrow, the translate, it's the save the date. I say it in French, it's tomorrow.
Wow.
Yes, the flyer of the save the date tomorrow.
Okay. And with that, this has been a very good, productive discussion. Anything else, any new business? Just a reminder, we have 2 resolutions that will move to executive committee. And then, of course, at executive, any other committee that wants to take it in or add, they can do that or make that suggestion at that time. But this is good. We have 2, resolutions, and then we have additions for our, public health forum. Fantastic. Elizabeth, don't forget, I'm looking for you to follow up on, the person with the organization whose name that you recommended, whose name they're on my list in the event planning outline.
Okay.
Right.
Okay.
All right. And let's see, let's make sure we have everything out of the, chat. I'll give everyone a chance to look at the chat again, just to see if there's anything, is something else that you have for people to, you might email them, because I couldn't pull them up from the chat. Just copy and paste them on, because once I turn the recording off, we will have the chat, but I was so tired of listening to the recording, to do those minutes, it's crazy.
You can get the what you have.
But they transcribe it, it's still, that can be so much better.
I use it as notepad as well, so that when I reconvene my idea, I have that. That was helpful. Thank you so much, Laquita. Thank you.
Yeah, I don't see the ability to save. Like before, you could hit the three dots and then save the chat. I don't see that, at least on my
Oh,
end.
really?
I don't see it, so.
Hakil is here and he knows how to save the chat for
Yeah.
us.
Yeah,
But-
he can save the transcript and the chat as well. Yeah.
Okay,
Mm-hmm.
All right, so we will see, just read your emails, to keep posted on what's going on with the public health forum. We need your help. Please, everybody on the committee, prepare to stay from, you know, the whole time pre-setup. We just
Mhm.
mentioned that a couple of hours in advance. Everyone doesn't have to be there 2 hours in advance. I would think definitely the table sponsors.
Mm-hmm.
But be prepared to at least be an hour in advance of the start. So I'd say 10 o'clock since we start at 11. And then we end at 4 o'clock. And so it's a full day. Just please put on your calendar 11 to 5, 10 to 5. Okay? Yes, somebody's got it. It's everywhere. It's everywhere. Okay, thank you. Now, can I get a motion to adjourn the meeting? It's 8:52.
I motion to adjourn the meeting
I
at
second.
8:52.
I
Hotel-
second.
Okay, all those in favor, say aye.
Aye.
Okay, everybody. Thank you again and talk to you real soon.
Good night.
Good night. Let me just make sure,